San Juan Regional Medical Center is your community hospital, committed to making life better for the communities we are privileged to serve. In fact, better is our mission, improving lives through personalized health and care. What matters most to our patients matters most to us, offering a comprehensive range of inpatient, outpatient, and emergency care services so you can get the quality care you need right here at home. San Juan Regional Medical Center, celebrating life better here since 1910. Ten minutes past 8 o'clock. It is Wednesday morning, the 8th day of June, 2022. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico. Everywhere else, you can tune in at KSJE.com, and we welcome our viewers as well. Those folks who are watching on a screen, KSJE video is streaming out live to the Facebook page, YouTube channel, and Twitter account of KSJE. So we're glad that you are with us this morning, everybody, because coming up in the next few moments, an important conversation I'm having with the new Acting Administrator of San Juan Regional Medical Center. John Mayer is my guest this morning. Hope you'll join us for our conversation about the local hospital, what's next for San Juan Regional Medical Center, and some of the challenges facing community hospitals these days. That conversation begins in the next few moments here on KSJE this morning. Later on this hour, of course, Ron Price is going to stop by for another program from the archives. We've given Ron the summer off, but we're going to play some best of programs from Ron Price about life in the sandbox. So we hope you'll stay tuned for that on the radio at 8:50 a.m. on KSJE this morning. Next hour, of course, it's our classical music program, Roving with the Arts. Mick Hess is the host of that program. He'll be playing music from Gustav Holst, The Planets, and some of the other selections you'll be hearing today at 9:06. A 90-minute version of Roving with the Arts coming up today on KSJE. And that'll take us to 10:30, right on Four Corners. Tracy Hales-Vass is speaking with author Rachel Menard about her latest book called Game of Strength and Storm. And Rachel Menard will be visiting the Four Corners area later on this month. She has appearances scheduled, I believe, at the Farmington Public Library and also at Maria's Bookstore in Durango. So she is talking to her ahead of her visit. That's coming up today at 10:30 on KSJE, right on Four Corners. Don't forget, you can also connect with us on social media. In addition to Facebook and YouTube and Twitter, you can connect with us on our Instagram page as well. And if you're a podcast person, we invite you to connect with KSJE wherever you listen to podcasts. Forecast today, sunshine this morning, 69 degrees at the moment outside our studios here at San Juan College. It's going to be a warm day today, that is for sure. Mostly sunny skies, 94 for a high this afternoon, 64 and clear skies overnight tonight. Tomorrow, sunshine again with a high of 94, maybe hot enough to pop a thunderstorm in the afternoon, but we're not expecting much rain, I'm afraid. But 94 again tomorrow in the forecast. Partly cloudy overnight Thursday, the low 55. Sunshine, very hot again Friday, 96 for a high, 95 on Saturday. Winds will pick up Sunday, Monday, Tuesday with highs again in the mid to lower 90s to upper 80s. Joining me this morning to talk a little bit about his new role as the acting administrator at San Juan Regional Medical Center, the chief financial officer of the hospital as well. John Mayer is here in the studio with me this morning. Mr. Mayer, good morning. Welcome to KSJE.
It is my deepest pleasure to be here with you this morning, Scott. I'm looking forward to spending some time with you here this morning.
Thank you. Well, I am too, and I'm glad that you are here to talk a little bit about this new job that you have had since, end of March, I guess.
End of March, that's correct.
And so in addition to your other job, which is CFO, which has to be a busy job as well. So tell me a little bit about the changes. You're dealing with more of the big picture thing now at the hospital as an acting administrator?
Yeah, as the acting administrator, what I am doing in conjunction with my very, very capable colleagues in the senior leadership team at the hospital is ensuring that the community enjoys an uninterrupted service and that the normal day-to-day business of the hospital continues unabated. We can provide excellent care to our patients and our community while we're in a national search for a chief executive officer full-time. So I've agreed to act as the acting administrator at the request of our board of directors, and I am pleased and honored to have the opportunity to do so.
Very good. And I know, San Juan Regional is a community hospital, and so that's a unique, I think, position that it holds in the area, and maybe among other hospitals. We don't hear about a lot of other community hospitals these days, and so I think that's significant, and it has some pros and cons along with it, doesn't it?
It sure does. Our community is blessed. We have a institution, San Juan Regional Medical Center, has a history of 112 years serving our community. As long as New Mexico has been a state, our institution has been around and serving it through the Great Depression, a couple of world wars, and all things in between, up to and including a 100-year pandemic most recently.
Two of them.
Two of them,
now,
really, yeah.
Right?
So an ongoing 2-year challenge that has really tried not just our local community, but the nation, and has really been quite unprecedented, really, since the turn of the century with Spanish influenza. So we've been honored to be here along the way, serving proudly all of our friends and neighbors locally. Our mission is quite unique, as you made mention of. There are very, very few independent, standalone community hospitals left in the United States. Over the last decade or so, consolidation, vertical integration, and consolidation of hospital systems has been the norm. But we are deeply proud and stand by our independent mission, and it's a community-directed mission. That's what makes it so special, as part of an integrated ecosystem of not just the hospital providers, but all of the providers in our community working together to serve. So it's a tremendous opportunity to be a part of something very purposeful. I'm very proud of it.
Right, and not for profit, right? It is not in business to make a profit from the care that you provide, right? Isn't that the idea?
So we are a tax-deferred organization. We are not for profit. We are a 501c3. That is absolutely correct. But we are a business and have to keep ourselves going in terms of investiture and ensuring that the mission continues. But yes, we do not pay dividends or have shareholders, and we serve the community and our community-directed purpose mission. So it's a great place to be, where we really get to focus on maintaining the values and the core deliverables and access to wonderful care for a community with folks who deeply need that level of access.
Right. And we talked before we came on the air this morning a little bit about the shortage of healthcare workers, not just at San Juan Regional, but at hospitals across the country these days, and that is continuing. That's still the case, right? There's still a lot of openings and still the need for qualified healthcare professionals to step up? Yeah,
this is a national phenomenon. The pandemic has been very, very difficult on those that have chosen to serve as caregivers across the board, and a 2-year, a really incessant burden of care. Just to kind of give you a little bit of a feel for it, Scott, in the 5 years preceding the pandemic, from 2016 up to 2020 as an example, the hospital's average daily census, that's the number of folks bedded in the hospital on a daily basis on average, was about 102 a day. Over the last 2 years and this year, we've seen our average daily census increase about 40%. So this year to date, we're at about 142 average daily census. And at the height of the pandemic, this last go-around of the pandemic, in November, December, and January, we had census of 200, where we were literally out of beds. And staffing, of course, coming back to your point, is what's been challenged on that. That influx of care and the requirement for care has put a tremendous burden on staff, and an already short area of really skilled licensed professionals. We had a shortage prior to the pandemic, and of course the pandemic severely exacerbated that.
So anyone in business can probably do the math and figure it out that if you have an increase in customers, as it were, patients, and already a limited staff, something's got to give.
Something has to give. We've been able to augment our staff with travelers and ensure that we have safe and efficacious care available to the community and our patients. But that comes at an extremely costly rate of expense, and it's not sustainable. One of the things that I brought with me today to speak to a little bit is what's keeping administrators around the country awake and thinking and on the bridge of the ship looking forward. Staffing is number one, and then the cost of care and care delivery has been really challenged. Wages and just the cost of goods and services in total. Medical goods and supply inflation has been really escalating quite rapidly, and those are the things that we are looking to work for solutions against collaboratively as a multidisciplinary team, all the clinical leaders involved in these decisions on how we can best posture the hospital to continue that mission. Interesting fact, in Becker's recently, the National Policy Center for Payment and Payment Delivery, which is a very well-respected, unbiased think tank that looks at hospitals and their survivability, economically speaking, published an article in March where they have estimated 500 rural hospitals like ours are in immediate jeopardy of closure, with another 300 hospitals in immediate jeopardy, or not immediate jeopardy, but relative to their immediate future, at risk of closure. And the thing that I really want to celebrate is that that's not us. That's not San Juan Regional Medical Center. We are well postured to continue to deliver access well into the future, not just deliver it today, but grow into the future. And I can talk a little bit about that more as well. But really, because it's a great place for us to be as a community.
Well, I'm glad to hear that. I think a lot of our listeners and viewers are glad to hear that too, because we know how much the hospital does for the community. It is certainly an economic driver in the community, a major employer in the community as well. And so when we hear about maybe these mergers or these things that are taking place with other hospitals in other states or other parts of our state, and our hospital remains an independent, community-based hospital, maybe people are wondering, well, maybe we do need to find a bigger fish to join or whatever, or stay independent. How difficult does that get, I guess, in the grand scheme of things, when you're up with the big guys and trying to still elbow your way into the room to make contracts and negotiate and do all the things that you need to do to stay competitive in your field?
Yeah, we feel very good about our ability to remain as an independent mission. I when I'm out shopping or I'm in a grocery store, I bump into friends and people in the community, and the last, I heard we're for sale. It is absolutely not the case. We are extremely solid from a perspective of our balance sheet, and not just are we, poised to be able to handle what is in front of us with maybe another wave of COVID. We are well positioned to actually expand our footprint and provide access in other places in the Four Corners area and actually grow. So the hospital is extremely stable. We are absolutely not for sale. We utterly value the independence of our mission. I believe, I'm glad we have an opportunity to speak about that. Our independence and our ability to be nimble in our decision making, I believe, saved lives over the last 2 years, Scott. So we didn't have a bureaucracy to run through when we needed to flex or make decisions that impacted care and our ability to change or reconfigure operationally. We were able to do so with multidisciplinary teams and on advice of our wonderful physicians and caregivers, flex to accommodate patient loads, and that nimbleness literally saved lives, I believe.
Good to hear and good to know. And I know regular listeners and viewers of this program certainly do recall having doctors from San Juan Regional on this program talking about COVID and the surges and the things that were happening for their patients and the patients that were coming in, and how to meet that demand and how to deal with all the influx of patients, as you mentioned, almost 200 a day at some times during the last couple of years. And so I think that's really important for folks to understand kind of what you all were dealing with, and you got a lot of community support too.
Yes.
Through that time, which I know you're very grateful for.
We have a wonderful and wonderfully generous community, and I'm very proud to be a member of it. We had help from all areas of our community, all of the wonderful local businesses who offered support for PPE and helped us navigate what was really something we have not seen in 100 years. And we were also able to call on our federal assets. The United States Navy provided supplemental care teams. We had disaster recovery teams come in from over the state and in the Four Corners region. We were blessed to have this community support, and a lot of that had to do with the hospital has a very, very wonderfully close working relationship with our municipalities, the San Juan County municipalities, other municipalities around, and we're deeply grateful for that. We work very carefully and closely with all of those civic leaders to coordinate care with first responders and our local and state and federal delegates. We're very blessed to have that level of collaboration for the sole purpose of caring for our community, and we're deeply grateful for that.
It's good to know. And again, is that a different maybe that you have being that independent type of hospital that maybe a hospital that's part of a larger group maybe doesn't have the flexibility to have those types of relationships or those types of community outreach that San Juan Regional enjoys and takes part in?
I think one of the things that here in the northwest corner of the state, in the middle of a really vast geography, we're required to work together with folks, and we do that with enthusiasm. I just think, Scott, when you're smaller, you have an opportunity to be a little bit more creative, and I think that there are real strengths to that. I believe that the larger systems do have the opportunity to make decisions and move adequately and provide excellent care for those that they serve. I just think we're advantaged because if I needed to pick up the phone and ask for help from someone at the county or someone in Farmington in the mayor's office or anywhere, that's a simple phone call away and it's immediate connectivity. And during the pandemic, our incident command team members were able to do the same things with members of the state here locally and federally as required. So it did help tremendously.
Good to know. And again, you mentioned about some of the things that keep you up at night or other administrators up at night. When it comes to hospitals and healthcare, we know it's a complicated industry and there's a lot of moving parts. And then, of course, you have the federal government and the state government saying, how can we tweak this or do this a little differently, or insurance or Affordable Care Act, things along that line. Lots of different things that could kind of, I guess, upset the apple cart, if you will, to try to improve things for everybody. I think that's everyone's goal.
Right.
But there are also these unintended consequences, perhaps, when you try to fix something over here, something on the other side of the room goes wacky, and you got to maybe deal with that. Is that something that you're paying attention to? Are there things coming down the road that concern you, or that you're watching, whether it's at a state level or at a federal level, that could affect our hospital differently maybe than was what is intended?
Yeah, I think the fact that we are a very close-knit community helps us to be able to steer and navigate from the bridge of the ship, as I just mentioned, a little bit more efficaciously. Having access to our state and federal delegates, the local leaders here in the community, that rapid access and that really collaborative working relationship helps us to stay out in front of what the issues are, and it helps us keep our legislators informed of what the challenges are moving forward, so that we can work through the New Mexico Hospital Association and our state and federal delegates to help influence and stay abreast of what will help provide access to that excellent care that we deliver here in our community. And I think we are really blessed. We have just a wide array of access to great care, and that care saves lives every day. Our neurosciences team, we have 3 neurosurgeons on staff, as an example. We have a neurosciences team, an interventional pain management team that provides relief and quality of life for those that are suffering with chronic pain. Our internal medicine physicians are wonderful. I don't want to speak too many things. I'll make someone upset, but just in short, it is very rare that a community of our size has access to such a wide array of caregivers right here locally to deliver really cutting-edge technology. We've implemented $57 million worth of capital improvements for therapeutic and care and access opportunities for our community over the last 3 years. And we're poised with another $65 million of capital to be able to expand those services even further. We are literally on the vanguard of care capability, and we have the best and brightest folks at the bedside to deliver that care. And that care is also affiliated to the community physicians and providers here that are part of that whole comprehensive ecosystem of care that we do have. We're blessed here, Scott, and it's great to be a part of a mission like this.
And as you look at that and look at some of the investments that you're able to make back into the facility and into the community and provide this extra care, it certainly is a reflection, I think, back on the area of Farmington, in that we are kind of a retail center. We have a lot of folks who come into this area for shopping and for schooling and medical care, I think, too,
Yes.
is also now becoming more and more of a part of that, as I
Yes.
mentioned, an economic driver.
Yep.
Is that something that kind of drives some of these decisions, as well as the unique makeup? Because normally towns of 47,000 people don't have access to the type of specialists that you talk about that work and live here in the community, because of our unique, I guess, makeup.
Yes, that is absolutely the case, and it's exciting to see what the leaders of the community are planning for us for growth and development. I have a very bullish view on where we are as an organization and as a community, and see bright things in our future. And those are the things that really are important. You don't have vibrant, healthy communities without a very comprehensive and vibrant health ecosystem. It's just not viable. If I'm thinking as a family member, well, I'd love to move to this particular part of the country, but gosh, what happens if my children get sick or I get sick? Who's going to care for us? That's a critical decision element in where people decide to migrate to live and put their roots in. And I believe that comprehensively for our community, again, with the hospital and all the other great providers that we have in our community, we offer that. And we're really poised to be able to even grow further with that access and capability to support the growth of the community. And I do believe that it is a cornerstone. Healthcare and healthcare economics are a cornerstone in growth for any community. And without it, you will not see that growth.
My guest this morning, John Mayer, is here. He is the acting administrator at San Juan Regional Medical Center, a job he has had since the end of March. And he's also the chief financial officer at the hospital. We're talking a bit about the hospital's financial health and some of the other challenges that are out there in the world these days when it comes to managing a hospital and serving a community well over 100,000 people. And you were mentioning some of the things that people look for when they're relocating to an area. We hear a lot about Farmington and San Juan County's efforts to attract maybe retirees.
Yes.
And that's another big thing for retirees, I would think, too, is access to health care. If I go somewhere and retire, am I going to have access to care if my health takes a turn or whatever the case may be?
Yes, and again, we're very, very proud of what we do. As a matter of fact, we've just refreshed and rebranded and announced ourselves, and what we believe in at our core is life better here. And part of having life better here is the ability for people who are in a moment of need, who are vulnerable, to be able to access that care and to know with confidence that they're going to have a great outcome. And we're very proud of what we do from an outcomes perspective, and the level of care and the broadness of the care that we can provide for those that are making a decision. I've worked hard all my life. Where am I going to settle down? And can I settle down somewhere where I feel secure from my healthcare needs and perspectives? And we believe that we can fill that. And not just with the hospital, but again, I'll keep going back to the community and access to the great caregivers that the private practitioners, as an example, that are out there in our community that are work very closely and collaboratively with us to make sure that we have all of those access requirements covered.
Gotcha. And let me ask you a bit about room for improvement and things along that line. You mentioned about the investments that you're making and things along that line. And so are there areas, and you mentioned areas of growth. And so what would some of those areas be? What are some of the areas that the hospital is looking at, if you can discuss that publicly?
Sure. There are a number of things we can discuss publicly, and some things that we're going to kind of keep quiet for a while because we're working on them and don't want that great news to get out just yet. But I think coming back is
typical, which is normal. It's
yeah,
not
absolutely normal. That's
sure.
Yes, absolutely normal. We just the first thing is we look to get feedback from our community members in terms of patient satisfaction and what can we do better. Every organization has opportunity to improve and consistently grow and do better at what they do. We are committed to doing that as well. So I would encourage those that enjoy a service or see a service, if there are rooms for us to fix something, we'd like to know about it. So please do take the opportunity to fill out a patient satisfaction form. The other thing we'd like to do is, did we do something well for you? Did you enjoy a part of the encounter? Is there something that we're doing well, but maybe could use a little bit more that made your encounter or experience great? We'd also like to hear about that. That helps too. Those good experiences, and we have far, far, far more of those than we do have bad ones, help build confidence in the community that their care platform is appropriate and can deliver what they want, so they can see us and visit us with confidence. As we look to grow, back to the growth and where we're going, it's really important that we have very close working relationships with all of the Four Corners communities that we serve. We're centered in San Juan County, and that's really where the majority of our encounters come from. But we have a regional mission. So if someone's out in the Biscay Badlands and has an accident, we can evacuate them and bring them here. If there's someone out that's up in Durango and there's an automobile accident, we can evacuate them here and save their life. We have that capability. So we're looking to plant and develop relationships in those communities across the Four Corners area, and those are the areas where we're looking to put better capabilities, systems, and more importantly, relationships in place. And that's what we're looking forward to do to actually expand the mission and the footprint to serve more people with the wonderful assets that we have.
Gotcha. Now, some folks listening may say, but there are hospitals in some of those areas that you mentioned. Does that kind of infringe on their area, on their turf, let's say? But I know San Juan Regional has a certain level trauma center that I don't think any other hospital in the area has, and so that allows you, I guess, to maybe take in more patients that need more serious types of care and things like that. So how does that all work with the other hospitals in the region too?
Super question. We do not look to do anything other than partner and provide the levels of care that are not necessarily provided in those other communities. So if, for example, someone has a head trauma that we need to take a patient in and care for that patient where those services are not available in Cortez or La Plata County, we do that. And we've invested in that life-saving capability, and that's one example. Another example of expanding that care and that access is as we serve moms and babies, our chief of staff and pediatrician, Dr. Bradley Scoggins, and our wonderful nurse leader, Sonia Crum, we're expanding our capabilities in delivering care to babies that are needing additional care and special care nursery services. And instead of sending families to Albuquerque or the Front Range to receive that care, they can remain here at home with the support that they need from their families and deliver the care that the child needs here locally. And we continue to look for opportunities to grow and expand those services such that we don't want people to have to unnecessarily go to Albuquerque, hundreds of miles away, or Phoenix, Scottsdale, or the Front Range in order to receive care. And we're looking for opportunities to provide that access so that you can receive that care here and be supported by your family and not have to travel so far away and endure the discomfort of that and the expense, et cetera.
One thing that we've seen that kind of follows that model, I think, is the Cancer Center.
Yes.
Which, again, a high level of care, very specific types of services provided, but unique to the area. I don't think there's another one within 200 miles. I may be wrong, and please correct me if I am. But this is kind of that same type of model, is it not?
It is. And speaking of the Cancer Center in investiture, we are just about to begin a progress on a brand new Linear Accelerator for radiation oncology therapies, and it is.
That sounds expensive.
It is expensive. About $5.3 million for that project to put it in. As one example, but that technology will enable us to deliver literally vanguard level of care for intracranial procedures, et cetera, with high levels of precision and truly benefit patients seeking oncological care here in our community. We're very excited about that. That's an example, and I'm glad I have an opportunity to speak to it. But we've invested $2.5 million on a brand new interventional pain clinic. We've invested $5.4 million on a brand new fixed wing aircraft platform for an air ambulance platform, so we can pick up or evacuate people to higher levels of care very, very rapidly and help save lives in that means and manner. We're doing wonderful things that way. We have a $2.5 million project for a Da Vinci robot for robot-assisted surgeries, which are becoming the standard of care in different service lines coming up. And the wonderful thing about that is we have two brand new fellowship-trained surgeons who are going to be joining us in short order to help our existing staff who are trained on and will be using that machine augment those capabilities. So again, we're not sending people away to receive their care. They're able to do it here more closely to home and at the very highest standard of care that's available today technologically.
Let me follow up on a couple of things that you mentioned. First of all, with the Cancer Center, with this new piece of equipment, does that mean the center will have to be closed for a while that is being installed and swapped out or what have you, or will you be able to continue using the old one while the new one's coming in?
No, the center will need to be closed based on the level of construction and implementation work that's required that way. But what we've done is we've ensured that those that are receiving therapy today have therapy close. When Durango swept their machines, we did something similar with them.
I see.
So there's a continuum of care that's available to the patients. There will be no interruption in their care. But we will be taking the center down a little bit in order to get that new technology stood up. But that new technology will last us years.
How long do you think that's going to be?
October is when we finished. We're anticipating being finished. We're about to start the project now.
Okay.
And we should be done in October with that particular work.
A few months.
Yeah, just
sounds
a few months.
like. Got it. The other thing that caught my attention was this surgical robot that you mentioned.
Yes.
That sounds very interesting and very cutting edge.
Yes.
And so the idea being that you could have a surgeon anywhere else in the world, I guess, be able to manipulate this device to have a surgery on a patient, or would it still be a local doctor doing this type of procedures?
Well, as we journey,
how do you foresee this?
We foresee this with the immediacy of the local physicians or the surgeons here locally being able to manipulate the robot to, in terms of precision and speed of recovery. There's clinical data that has that as the main advantages. But we won't be doing remote surgeries. The robot will be used to surgically assist the providers that are here physically with us. So we'll be doing that locally with our local surgeon talent.
I see, and they'll be in the room, I guess,
yes,
with the device.
Yep,
and
the surgeons
all
are
that.
working the device, so it's not you're not in a complete without the care of the actual physician present,
right,
and doing the work. It's just a way to help assist that excellent surgeon with the precision and the ability to do things in a far more precise manner or assisted manner.
Sure.
Yeah. So it's far less tissue damage and things of that nature are the benefits, and recovery times, et cetera, are aided as well with that type of technology.
Gotcha. Very interesting. But again, it sounds expensive.
$2.5 million. But
Yeah.
it's something that we are absolutely willing to make investments in, because that's our mission, is to provide the best care that we can with the technology available to our friends and family here in the Four Corners area.
And down the road, I mean, could this mean that if someone came to San Juan Regional and they had some type of need for some very complicated procedure, could another physician from some other off-site location be able to use this device to maybe do a procedure like that? Or is that something we're not there yet, maybe with the technology or what have you?
Well, if they're proficient and certified in the use of the machine, then another surgeon could potentially come in and perform a procedure with that. But we would be at this point in time really focused on our cadre of excellent surgeons on staff using that robotically assisted capability to perform procedures.
Understood.
Yeah.
Thank you very much.
Very welcome.
We just have a couple of minutes remaining this morning, Mr. Mayor, and I wanted to ask you a bit about the steps to, I guess, find the new CEO of the hospital. You're in the acting administrator role at the moment. There is, you mentioned, a nationwide search
Correct.
underway. Do we have a timeline on what the board hopes to be able to maybe bring back to the community and talk about maybe some candidates for this position?
Yes, we've interviewed search firms, and we've gone through that process and have selected a national search firm. The search firm that we've selected anticipates that we should have a permanent chief executive officer in place in about 4 to 6 months. That's their normal timeline. Everyone's very bullish about being able to secure an excellent leader here. There's a lot to come to here. So 4 to 6 months is the usual timeline. The particular search firm that we have has an excellent reputation, and when they place a chief executive, that chief executive usually stays for, on average, about 7 years. So we've been very, very diligent and thoughtful. The board has really done its homework and making sure that we're going to do the due diligence, find an excellently qualified candidate that's going to be a long-standing member of our community and help lead us forward as we go through growth and all the challenges that lay in front of us.
Got you.
Yeah.
And I think that's important for a lot of folks in the community, maybe a lot of folks on the board, to find someone that is a fit
Yes.
with the community. Maybe you yourself know what that's all about, coming here from a larger area just a couple of years ago and settling in Farmington with your family and becoming part of the community. I mean, I think that's an important part of any new executive coming into any town, to be able to get involved and get connected. Maybe during a pandemic a little more difficult than it was beforehand, but that's an important piece of this, isn't it?
Yes, it absolutely is. Our community offers so many benefits for folks looking to relocate and join just a wonderful a wonderful extended family, so to speak. And the independent mission is very attractive to people who are, looking to be directly plugged in to what the community wants and needs, and helping to steer those desires and provide excellent access to care. So I do think that we have just a tremendous amount to offer here. It's a great place to be, and we would be very, very desirable to any person who's looking to join us. And as a matter of fact, just to kind of comment on that, we had a bittersweet moment and said goodbye to a wonderful clinical leader, and Mrs. Suzanne Smith, who spent 39 years with our institution and left us as our chief nurse just a couple of short weeks ago. And we are delighted to welcome in Ms. Cammie Monarch, who is going to be our new chief nursing officer. Her last assignment, she spent 9 years at the University of Oklahoma's hospital, Boomer Sooner, and is going to be joining us here in just a couple of short weeks as well. So we feel very good about being able to attract the best and brightest talent to a wonderful community with just a super mission.
Well, I know recruitment is always a challenge for rural, smaller hospitals and medical facilities and things along that line. I know, and I think even schools and school districts and things along that line as well. So that can be a challenge. But again, it sounds like, with the way to promote the community and what the hospital has in place and the financial stability and,
yes,
and future goals that you've talked about this morning, that probably makes the job of recruitment a little bit easier.
It certainly does, and the financial stability should not be understated, and that's a key a point of emphasis that I'd just like to share with your listeners today. Our hospital is strong. We're not for sale. We've grown tremendously. Our last 2 rating cycles with the Standard & Poor's Group has allowed us to secure $20 million of new capital for growth and development, and we are in a very, very solid footing right now to continue what is a wonderful 112-year mission. And we truly intend to make life better here through that strength and stability. And it is attractive to folks who are looking to ply their craft in a wonderful community such as ours.
Well, Mr. Mayor, it's been great speaking with you, getting to know you a little bit this morning, and sharing some of your visions for the hospital and what's going on there at the moment. So thank you very much for coming in this morning.
Scott, it's been my pleasure, and I'd love to do it again sometime soon.
All right. We'll have you back.
All right. Thank you, sir.
Thank you very much. That's John Mayer. He is the acting administrator, San Juan Regional Medical Center, my guest this morning here on KSJE. KSJE is supported by the Alzheimer's Association, New Mexico Chapter, with a local office in Farmington, providing free services and resources to help those living with dementia and their families, including their 24/7 helpline, 1-800-272-3900. The Alzheimer's Association, New Mexico Chapter, 1-800-272-3900. KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Country music stars Lone Star, Thursday, June 9th at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or 505-599-1148. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, my name is Emin Chi. I'm here with the San Juan College Student Achievement Center, bringing you coaching tips of the week for the radio. Week 1, organization is key. First and foremost, make sure you get a college planner. This can be a planner with a creative design, a plain notebook, a wall calendar, or even a small, dry erase calendar for your desk that changes each month. A wall calendar or desk calendar is best for double-checking appointments, events, and due dates, while a notebook planner of some sort will be best for planning on the go wherever you are. This planner will help keep you in check when you are in class or in a meeting with your advisor. If digital works better for you, you can sync your computer, phone, and tablet. Also, think about setting up an agenda on your mobile device. You can set up reminders for test dates, department events, study times, and assignment due dates.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.
Should an algorithm